I'm glad that this case is very well joined with the first case that Aleka showed, and with the lost muscle case, and with what you do. It's one of my disaster cases. I don't know what to do next, so I brought it here, so I get your opinion from at least 10 experts and another 50 pediatric ophthalmologists. So this is a case of a boy born in November 2010 with no family history, no past medical history, normal delivery. It's the third child of the family, and they brought it to me at the age of 1 year because of a fully alternating esotropia, approximately 7 prism diopters, cross-fixing, probably full extraocular movements because the cooperation wasn't very good, and the cycloperiodic refraction of +2. So I thought it alternates, so see him again next year. Comes back at the age of 18 months, same findings, the angle is the same, visual acuity it's now definitely the same, but I record that there's probably no abduction. And I put the question, could that be presbyosmus fixus? Anyway, the boy doesn't cooperate very well, so the mother pushes for surgery, they want something to do. So what should be our next plan? What would you do next? Obviously what I did was wrong, but maybe what would you do as experts? Darius, Julie, Alekos, Harris. It's not definitely that it doesn't abduct, but I'm pretty sure at that point.
Well, the first thing is diagnosis. What is it? Is it a congenital esotropia? Is it a sixth nerve palsy? You have to, first, I think that would be, my biggest worry is what is the underlying cause for this? Mm-hmm. Has the child ever been able to go at least to the midline or further out? Don't know.
Don't know.
Well,
but mother wants something done.
Yeah, no.
And okay, what do we do next?
I would first want to make sure what the diagnosis is.
Okay. What I did is I definitely did an MRI to outrule something like something probably that would be causing a bilateral 6. You can read it very well, but the MRI is absolutely normal. Okay. Then I thought I'll do a forced action test, but because he's nearly 2 years now, I thought I'll put him for surgery. At the time of surgery, I'll do a forced action test. And that's the findings. The forced action test was negative. I decided to do large bimedial recessions. And would you do the same? And how would you expect him to be post-op?
Undercorrected.
Undercorrected?
Yes.
Okay. Yeah. Any other suggestions?
Don't tell me that it was overcorrected.
It's my disaster case. Shall I move next?
I bet the undercorrection.
Well, it's about 45 prism diopters, still alternating ESO, still limited abduction, and mother wants something done. What would you do, Alex?
Me? Something strange. Something strange. Always when there is restrictive strabismus, I do recession of the muscle that is responsible, and I resect the antagonist. Something that it is not correct for many, but I believe that you have to resect the antagonist just to take the sclac. Because the antagonist is elongated, and it needs, when you recess the muscle that has the problem, you have to resect also the antagonist. So this is what I do in cases like that.
So you would do lateral rectus resections?
Yes.
In both eyes?
At the same time I would do.
At the same time?
Yeah. From the first time. That's why before I said...
Simultaneously?
Simultaneously, yeah.
So 4 muscles at the same time to start with?
Yes, of course. Yeah.
But I haven't
done... It's so large angles, yes.
I would do what he did, maybe 9 millimeters, and then I would do a second time the resection.
What do you suggest? Resection should it be done before or now?
No,
Because
after.
Aleko said I should have done it before, which
Yeah,
is
I mean, it's his preference.
this is an option. But you will all do lateral rectus resection at this point. He's nearly 3 years old now. Yeah? I did it. I'll show you what I did. You want that?
Just to make a comment. About 10 years ago, I had a case like that. So I did what you did. With the same result. Yeah. So I decided to go for the letter rectus, the letter recti.
Do you want me to show you?
Section. But I was surprised because they're very hypoplastic. I couldn't even find them.
Stop.
Is that on the right?
Stop. At the age of 3 years, I'm going in and doing bilateral, I'm planning to do bilateral lateral rectus recessions, and I found both lateral recti to be hypoplastic, like Aleko's case. There was like a string rather than a muscle. So I looked everywhere. I said, that cannot be a muscle.
You had anisotropia, right?
Yeah.
And you went into lateral rectus recession?
Sorry, resections. No, that's a spelling mistake.
Okay.
I apologize. It's a resection. Okay. So I thought it looks hypoplastic, but I could take a big chop out because I was going to resect it. So I went all the way back, and it was still like a string. I never found the muscle as Aleko described. I chopped it and I sent it for histopathology. What do you think the post-op result was? So I pulled everything, chopped it, and what was left, I put it back in the original insertion. So it was a huge resection. Shall I show you the post-op result?
Okay.
Well, post-op, nothing, still 45. As if I haven't done anything at all. Still limited abduction. Cyclo is still +2. Visual acuities are equal. Histopathology confirms that it's only connective tissue findings with hypoplastic muscle fibers. And now I'm stuck because I have 4 muscles done, as Darius had in his first case, the lost muscle, and I need to do something more.
Okay.
It's not strange, the result, because
No, the result is
it's
not
like
straight. Yeah.
a bilateral lateral rectus palsy, paralysis.
So
It's the same.
I follow him up until today. He's 9 years old. He's still about 45, prism diopters, fully alternating, limited abduction. Now he has bilateral inferior oblique overaction. Visual acuity is almost the same, and I'm thinking of what to do next.
Okay.
From what Darius said, I got this idea of maybe fully chopping the medial rectus, going back to find the medial rectus that I already recessed in the past, and going and chop them, because it's one option. Would that be an option? Anything else suggested?
I would not do that.
Please help me what to do.
Or you would do a homocine.
But it will be a third muscle again. Huh? I'm a bit worried because it's going to be the third muscle in a child that is already abnormal.
You could do, I don't think there will be a problem. I think anterior ischemia will be fine if it's a healthy child otherwise. But what you can do now is OCTA of the anterior segment, if you have a machine like this, or a normal angiogram, and actually document how much circulation there is. If there is mostly dominant circulation from the superior rectus, you could use the inferior rectus, or vice versa. But I would treat it like a 6-nerve palsy. So do either superior rectus or the Hummelsheim, but create some force outwards.
That's what I did actually. The result was good. That's what I'm saying.
Would you consider bringing the medial rectus out
No,
as a lateral rectus?
The medial rectus has.
It's going to
hasn't
be
been-
difficult.
That hasn't been done. It was a lateral rectus that was put to the medial side. But
Any other options?
I would transpose as I said before,
Yeah.
Both
Either-
superior recti.
like
So
the
that's what you
Nisida
think.
operation, avoiding
The superior recti.
this, and
No,
avoiding also
half.
the vessels.
Half and half. Either Nisida or homocine.
And Nishida as a
In
as a
human side, you
sparing.
destroy
Yeah.
two ciliary
But
vessels.
very careful, because you're left with half of the superior, half of the inferior, And although you think that you are disturbing half of the muscle, studies have shown that if you do surgery, the inflammation can close the rest.
But definitely Nishida
Of the
would be
little
safer
arteries,
rather
yeah.
than a transposition.
Nishida is better.
Okay. A modified Nishida. Okay, let's move to the next case, which is not a disaster case. And it's quite interesting because this is a case that this is the story of this first case. This child born in November 2009 with normal family history had a trauma in her right eye February 2012, causing right eye exotropia. Dr. Khrusu presented this case in one of our pediatric meetings some years ago, showing very good results. After she attempted to find the medial rectus, she couldn't find it, and it was a lost muscle. She decided to do a Hummelsheim, and the child was post-op, ortho in primary, and almost full exocular movements. She gave me these pictures today. This is the child pre-op, after the trauma, and this is 2 weeks after the Hummelsheim, with very good movements. Now this child, Julie, if you want to add something.
Can I say something that I decided not to do a medial rectus,
it was a lost medial rectus.
a lost medial rectus. I decided not to do a lateral rectus anything.
That was it.
Do a Hummelsheim and see what I got. I was surprised that I got this.
It was an excellent result.
Yeah.
So this child moves from Athens to Thessaloniki, and she comes to me 5 years later. She tells me the story, and I said, I know you. They said, no, it's our first appointment. I said, no, I've seen you before. And they say, no, you're crazy. I said, no, I know you because I know your story. Julie presented this case and was very impressive, and I'm glad to see you again. So she was followed up by Julie until June 2013. She gave me a very good letter. Had some patching. By that time, she developed some hyperopia, and she was given specs with good vision, and she continued to be orthophoria. Now, she came to be in January 2016, so many years later, with good vision, with the right esotropia. I did cycloplegic refraction. She was a bit undercorrected at the time. She was lost for follow-up for some years between myself and Julie. And I gave her some new glasses. She continued to be right esotropia, 15 prism diopters for distance and 45 for near, with double-checked cycloplegic refraction. And she, after I kept seeing her for some years, she wanted to have surgery. So what would you do? Remember that in one eye she already has the Hummelsheim, and that's what she is. She's esotropia more for near. Refraction is triple checked, I'd say.
Bifocal? Did you try plus 3 just in your room?
Well, I prefer to try bifocals if they're younger and if they're fully corrected for distance. In this case, even for distance, she still had some angle.
Extraocular movement.
But it could be, movements are fine. Yeah, she's moving everywhere. The Hummelsheim is perfect, honestly.
Maybe Cooper's with recession and resection.
Τα version είναι σωστά. Τα version
Yeah.
Yeah, the movements are fine. So one suggestion is to do Faden suture. Yeah, we call it Faden, but the German school calls it Cupid.
Faden.
Faden means suture.
Faden.
Yeah, Faden.
But Darius speaks German and English, so it's easy.
There's another operation.
What would you do? I did something, it went well, but I was a bit puzzled what to do.
I would do bifocal test first, for sure, to make sure it's... And then you have options. You can do Faden or retroequatorial myopexy. There's also another operation, is the Prieglinger operation from Austria, where they do a very long Y split of the muscle, and then transpose it out, and effectively, it's like a faden, is that the point of rotation is weakened, and this would be a very nice case for that. They've looked at 50 cases, compared it with a conventional retroequatorial myopexy, and these are very nice results.
Any other options? Any suggestions?
Very large recession.
One eye.
The opposite media rectus?
And fixation suture.
Okay. I went more.
I don't like any more fixations, posterior fixation sutures. I used them many years ago. Now I prefer large recessions.
Because I also don't like much the FAD and cupus posterior fixations, and I should try them more.
So you went to the other eye.
What I decided to do last June, after having lots of pressure from the family, because I was trying to be hesitant and put it back, I decided to go in the other eye, in the left eye, do the medial rectus recession, as you already suggested, and thought of being brave and anterior segment ischemia after so many years would be much of a risk. Go in the right eye. They already had the Humboldt and do a lateral rectus resect every year.
Why, Nico? Why you went to the right eye? You had so much room in the left eye.
Because, as you know, it's very hard to persuade people to have surgery in the contralateral eye, because they feel that,
Yeah,
no,
but
I
you
have one good eye, don't touch it. Anyway,
Yeah, but you did. You went to the other eye. You did the medial rectus.
that was after lots of discussion that
Understand.
we'll do just a little bit.
I understand. But the medial was lost. Hummel sign.
It was a risk of ischemia. Anyway, so far, I'm surprised that she does well. It's only 5 months, obviously, and she's orthophonia and a slightly overcorrection that for distance. She's slightly exo. I just reduced her hyperopic specs by +1, and I'm waiting to see what's going to happen in the future.
Very nice. Very nice case.
Thank you.
Nico.